Oh, yeah. Thank you. So once again, thank y'all for joining us, and we're very thankful that y'all are working in a very flexible manner. And so I think that Senator Barrow, when you had fallen sick, one of the key points you wanted was to make sure you could have a discussion with civil service. So one of the bullet points that we see is work with the civil service to develop full team model, and that kind of started the process to bring you guys in. So why don't y'all give us an update of what's transpired since the last meeting and what's been accomplished, and maybe what hurdles you're trying to still maybe cross. Okay. And then I'll turn it over to Senator Barrow.
Certainly. Byron Dept, Director of State Civil Service, and I have with me Ms. Nicole Tucker, who is our Chief Operating Officer. Nicole has been working very closely with DCFS, and it has been a privilege to work with them, LWC, and the Division of Administration. It's all been a partnership. I won't repeat what we have done already. I think the Secretary has a good job of already explaining the job fairs and so forth that we've been assisting with. I did provide you a document. This is a document that I put together, or actually Nicole put together, that I provided to our commissioners because DCFS has been coming to our commission requesting pay mechanisms and so forth. We thought it was important to kind of show the overview of DCFS and their different programs. But what you'll see on that paper is all of their existing pays. So for the Child Welfare Series and Family Support, if there are special entrance rates that are currently approved for those individual jobs. And then I believe the last page is the page that are the temporary mechanisms. So the department did come to the commission and was looking for ways to incentivize their employees. One of those ways is through temporary premium pay. Premium pay is not a part of an employee's base pay. The goal of premium pay is to get the employee to stay, because if they were to go to another position that is not authorized for premium pay, they lose that premium pay. So you'll see right now some of their workers have up to $5 an hour, and then they tiered that down to $2.50 for a different level of employee in the Baton Rouge and New Orleans area. That is approved through February. I will just mention that that is very similar to what we have done for the Office of Juvenile Justice, and that's a temporary measure as well. So what the commission will be looking for is basically feedback and data from the agency. Is this helping you recruit? Is this helping you retain your employees? And then we reassess it at that time. So the commission has been on board with their request. I believe that the other request that I did not mention, they also have an incentive policy for a strike team that came from other agencies within, other units within their own agency to come to Baton Rouge and work to get the backlog of cases down. They have some lump sum payments there that are approved. The commission approved that. So we are continually working with them. I know my team has weekly meetings, as Secretary Walters said, with them. So if there is anything that they need, we do our best to position it in a manner that we can gain support from our Civil Service Commission to help them with their needs.
Sir, anything you wanted to add to it?
The only other thing, Nicole Tucker, Chief Operating Officer at State Civil Service. Last time we talked a lot about the minimum qualifications. That's probably the other big thing that we have worked on with DCFS, and that was our first thing after the last committee meeting that we worked on to make sure that we got that in place before the first first hiring event on the 23rd, I believe. So we put that into effect on the September 21st with the agency. We worked with them for a couple weeks to really make sure that we and the department were very comfortable with the minimum qualifications. And I believe Deputy Secretary Ricks talked about how that's kind of a pilot, and we are going to assess, and they're working with several organizations and the metrics to see the caliber of the candidates that they're getting with the new revised minimum qualifications, and how those applicants and those employees are working out compared to those that came in under the previous minimum qualifications.
Which I will say is they should be commended upon that. At a time when we do not currently have applicants, to open themselves up to additional applicants and see if they're going to work, that is something that they should be commended for, to basically cast that net a little bit wider and to see if any of those individuals, how they will tier up to the previous qualifications.
So for one quick question, but when you look at it looks like for all child welfare specialists, there's a premium pay for those positions, correct?
That's based on longevity, yes.
On longevity.
Yeah, that one is based on longevity, but there's also the temporary one specifically for Baton Rouge and New Orleans.
Understood.
It's statewide, any child welfare specialist up to $4 an hour, and it's based on longevity with the department.
Understood. So on the temporary one, if someone works out with the department, it becomes embedded in their base salary?
No, sir. That would be something that we would have to work with the particular agency, any agency who has premium pay. We would evaluate that to see, is it working? Typically, we just extend that premium pay. There have been times when we do job assessments, for example, where we may look to see that funding is available and that everybody's on board with raising the salaries. We could make up for that temporary pay when we relook at salaries and so forth. But typically, we just extend those premium pays as a way to retain those particular employees, because it is a carrot. If they leave, they lose that particular pay.
But there could be where you join it, you're doing a good job, and you could potentially lose that bump?
If the commission were not to extend it, yes. But
Okay.
as I said, we will work with the agencies. If it is something that is proving to be beneficial, we will certainly work with the agencies to do our best to come up with a mechanism to where hopefully the employee would be able to retain a portion of that or have some other pay mechanism that would cover that.
Okay, thank you very much. Senator Barrow?
Yeah.
I think what everybody's taking a guess is you have a good employee, they're performing well, and all of a sudden they could get a reduction in pay. It seems like that'd be catastrophic for the department.
Yeah.
Right, and that's
I think that's
something-
what I'm hearing my colleagues taking that breath, like,
Yeah.
we hear what you're saying, but it just doesn't seem like a plan.
It doesn't sound, when you are listening to it, when an employee has a job to do and an employee is paid for that particular job, and you have a backlog or you have an emergency situation and you want to incentivize your employees, you're going to pay them for a temporary basis at a higher salary. With a job like this that has high turnover, certainly we would do our best to try to keep that. I have not seen many circumstances where premium pay has been taken away from the employee and the employee has lost money.
Okay.
So I will, if that reassures you, hopefully.
That's a little bit more comforting, because I was going to ask you, how does that work? And I know that you don't control it, that the commissioners actually would make that determination, but that would be, to me, catastrophic, really, for an individual to now have gotten somewhat accustomed to. They're doing the work, they're doing a good job, and then come February, it just automatically is cut, or March. It's cut, and I don't know what the process is. So what is the procedure? I mean, it's going to go back before the commissioners, and when will you have a determination, and what would they be looking at? Because OJJ is in this situation, and so is GCFS.
And we reached out to the department shortly after it was approved to ask and make sure that they were tracking some metrics that the commission will most likely want to see, which are those turnover numbers, recruitment numbers. So we, on our weekly calls, we definitely bring that up, make sure that they're tracking that overtime. If you're not getting applicants, obviously your current employees will be working overtime, things like that, that obviously that pay mechanism is helping. But Senator Barrow, just to kind of bring to your attention the way we've kind of done it in the past with some agencies, where we have implemented a higher premium pay, like the $5 an hour, in the time before we get to whatever the temporary end date is. We'll be working on, let's say, an additional or a higher SCR, special entrance rate, which the child welfare specialists already have. That is a part of base. So what we may do is we would amend that special entrance rate to something a little bit higher, and then maybe reduce the premium. But when you look at in totality, no one's losing any money. You may just have more that's going into your base under a special entrance rate with a corresponding adjustment, which means all current employees would get that corresponding adjustment plus maybe a $3 premium pay or a $2 premium pay. But when you look at what that corresponding adjustment did, you also got $3 in your base. So it offsets it. So no one essentially would be losing money. And we do a very deep analysis whenever we are doing something like that, where maybe there is a temporary premium pay that we need to end or we need to look at. We'll look at maybe amending that special entrance rate as well as lowering the premium. And then when you look at it together, no one's losing any money. Sometimes people come out.
So does that happen simultaneously?
The
Yeah,
rates
yeah,
and
that's
the
what-
SDR
yeah, yes.
at the same time,
Yes.
lowering the premium. Yeah, we typically do it at the same time,
Okay.
so
Or
that
if-
no one would lose money.
Or if we need time, we would get the commission
We'll
to
extend
extend the provision for that temporary pay. You know?
Okay.
I mean, I can't sit before you today and say yes that the commission will approve this, but I can attest to you that we will make every effort to ensure that we're going to do our best to make sure that we come up with other mechanisms to have the employees to continue with what they're used to earning if this is making an impact. And right now, just remember, this is just Baton Rouge and this is just New Orleans.
Okay.
Yeah.
Okay, and we appreciate what you guys are doing and the effort and the time that you are putting into this. I just don't want to. I don't want it to be set up really kind of designed to fail, but it seems like you guys are really being somewhat intentional to try to make sure that we're putting all the safeguards around it and trying to make sure that we're getting it to work properly with the proper funding, because that's the other component of
That's
this.
the other component too. Yes, we would want to make sure that the funding is there. We certainly don't want to increase salaries and then there not be funding for it. The funding comes from the legislative branch. The determination of the wages is going to come from my commission and the governor. But we like to work with the legislature because we don't want to approve something and then the legislature say, well, we don't have money for this. So we need to work as a team with that.
So special entrance rates for child welfare workers, trainees. Okay. I'm gonna withhold the rest of my questions for right now.
Thank you very much. Senator Carter? All
Thank
yours.
you. Thank you, Mr. Chairman. I have in front of me the hiring fair for tomorrow, October 21st. Today is October 20th. Just for the people who are watching at home, especially those in my area, and I guess I could ask DCFS, what's the range of pay that's going to be available for like some of these positions? Like there are jobs available. There's a health fair. I keep saying health care, but there's a health fair tomorrow in New Orleans, and there's jobs. The pay range is going to range from what to what about? Approximately. If you can help.
I mean, I can definitely tell you for child welfare. Let's see.
Child welfare has the trainee
Yeah.
is currently their special entrance rate is $36,524. Now they also have that longevity pay that Nicole mentioned. So a new employee would get what, $1?
$4,000 a year. But
$4,000
yeah.
a year. Yeah.
Yeah.
So for the health care, so there are positions starting off at
Typically for child welfare.
This is child welfare. Yeah.
So there's positions starting off right at $40,500.
That's specifically for child welfare, and I keep saying that only because they're also, like DCFS in that flyer says it's a hiring event, it's not just child welfare, so they're also looking at social service analysts. That's on both sides of the house. That's on Office of Family Support, and that's on Office for Child Welfare. They have workforce development specialists, I believe, and all of those salaries are going to range. I don't have that in front of me.
And so that was going to be my next question. So I'm looking at the hiring fair flyer, and I see that child welfare specialist. I also see social services analyst specialist. What's the range of pay for that position? Do you happen, if you know, or is that also $40,500, or is about that range?
Social service analysts, I know they have an SER, but just for the minimum was $27,000 to about $27,700 to $53,000.
To $53,000?
Yeah, but we're currently special
Have a
entrance rate that
special
was
entrance
approved.
rate, that's at 34,153.
So somewhere between 34 starting, and it ranges up to 53,000.
Yes, that's the max for that
The
particular
max.
job.
And,
for
and
that
then we also have, and I saw on here, administrative coordinators. What's the approximate pay range for the administrative coordinators, considering what's the base, and then the if there's any add-ons for that one as well?
That I don't have in
Yeah,
front of me.
it's going to be lower, the administrative
lower.
coordinator. It's going to
Yeah.
be lower. But we could get that information for you, and I would also encourage, Senator, those individuals that are attending the job fair, those jobs are announced on our website. So if they go to those job postings, they will see that information.
Well, I'm hoping to put on social media that, you know, that there's a hiring fair in New Orleans tomorrow, where we're going to be looking for how many jobs are open. Do you know approximately how many?
Positions.
Approximately.
So I don't have that information in front of me, but what we're doing is looking for all qualified candidates and the best of them, and even talking to them about positions in other areas, like if they're showing up in New Orleans, but they're really also available to work in Baton Rouge. So we'll be working with them, and we're doing a little bit of what I would call overhiring, understanding, for example, that in Baton Rouge there were 11 persons that were provided on the child welfare side a job offer, but we only will be onboarding 8 of them. So understanding that there's an attrition that naturally happens, that we will be looking for as many candidates as possible. So we will be able to provide that information if you'd like to know how many vacancies we have, but we will be doing some overhiring.
And let me ask you, for those individuals who may be watching at home, what sort of qualifications are you looking for? So if someone has a particular skill set, a particular background, how do they know whether or not this is an opportunity for them to go seek a job pursuant to this hiring fair, that we have tomorrow, and others throughout the state?
Well, Senator Carter, I would say the first qualification is a love for people and a desire to help. Most of the jobs that are outside of the administrative positions, those are professional level jobs, so they basically require a degree, a bachelor's degree. However, there is a 6-year where you can substitute that degree if you've been working in an industry with children or in social services that can actually substitute for that. We are, though, looking for people who can write. Everything that we do requires lots of notes, and being able to speak well with the client and articulate those things. So in addition to the minimum qualifications, we are looking for people who have the heart, who are a bit hardy, because there's a lot of reasons not to take our jobs, but the best reason to take our jobs is because you really get to help people.
And when and I understand you said for the professional jobs that a degree is required. Is it required in any particular field of study, or is it a bachelor's degree, or is it a bachelor's degree in social science, social work, or psychology? You tell me.
Absolutely.
That was part of the minimum qualification update specifically for child welfare. Workforce development specialist, that's a professional level job. It's just a bachelor degree.
Okay.
And that's the same thing that we did for child welfare. It's just a bachelor's degree. The 6-year sub is just 6 years of working experience, essentially. Whenever you get to the specifics is the type of experience. So if you want to qualify for a higher level within the series, so instead of a child welfare specialist trainee, maybe a 1, 2, or 3, that's where the specific experience will come in. But I will say that we will have civil service staff there. I will be there, where we are actually working with applicants that are coming in. I will say, especially in Baton Rouge, I was at the Baton Rouge one. We had several people that came in just kind of, looking for a job potentially and didn't really know where to start or wanted to know more information about the different jobs. We were able to look at their application and say, you qualify maybe for all 6 jobs that are available. You only qualify for these 2. done, but I will tell you that rarely happened, because I think even in New Orleans, we are looking, or y'all are looking for the transportation worker, which essentially that minimum qualification, I don't think is anything
As a high school
on.
degree.
So if you have a college degree in any field, or if you don't even have a degree, you can show up tomorrow at this hiring fair, and the state is going to help find those individual jobs.
We will tell them what jobs they qualify for, yes.
And many of these jobs, the value about having HR there to talk with them, or that they're in career progression groups. So HR can explain to them how they will progress through their series. So yes, we're offering you a starting salary of this, but within a year, you'll be here. In 2 years, you'll be here. So it's a good opportunity to meet the applicants face to face.
And do all the jobs come with benefits?
If they
Yes,
are-
if it's, yes.
Health benefits, those sorts of benefits?
If the full-time positions will, yes.
All right. Thank you, Mr. Chair.
Very good line of questioning. You know, the way Senator Carter was handling this, it was almost like what you see at the 12 noon, meet your neighbor or whatever, where it's it really is. Y'all may want to think of asking, but in anticipation of going like to one of the sites, to be on one of those morning shows or noon shows. So many people watch that, and basically this is the same rapport. You know, what does it pay? What are the qualifications? So y'all might want to reach out to all those TV stations in anticipation of going there, to be on those community shows, because every community has one, and it was really, this was a good dialogue.
Thank you.
Senator McMath?
Real quick, and to add to that, that's a great suggestion, Mr. Chairman. But also, at least in my area, our chamber is pretty active, and we've got a number of organizations like that across the state that would be good, I think, to reach out to and let them, spread the word on these job fairs as well.
Thank
So,
you, Senator.
and
Because
that's-
one of the best things with Louisiana Workforce Commission has been tapping into all of their networks to help the word out to you. And I think it does include them, but we will definitely
Okay, great.
reach out to them directly.
And since this is a working meeting, we have a lot of TV stations here. If you want to give us a free public service announcement, we'll show up. Y'all just talk to your boss.
We'll be happy to show up.
Yeah, we'll go do a public service announcement. Senator Barrow?
Just really quickly, last question. So we have another meeting in November and in January. Will you guys be able to come back to us probably at least by January to let us know what is the status from the commission?
Yeah, certainly.
Okay.
We will make sure we're at every meeting.
Okay.
Great idea. And we
Thank you.
appreciate you being here. Any more questions for Civil Service Committee members? Good. Thank you all for being
All right.
here.
Thank
We
you.
really appreciate y'all. Okay, so we'll keep our lightning round going, and we'll try and go through our deliverables pretty quickly. And once again, thank you for your flexibility in being here. We appreciate that. Oh, okay. Yeah, good report. So, y'all, the next item that we basically talked about the civil service piece. So, why don't we talk about expand and deepen hiring pool? It says your pilot was revised, the evaluating structure. So, unless the committee members have any questions there, I'll just kind of hit it real quick. And if it's something a committee member wants to ask questions for, we'll go from there. So, y'all will just be available to answer questions, if that's okay. If there's an item that you really want to target, then we'll just go from there. We'll do that. We'll finish page 1. University outreach. It seems like you have some timelines on that, and that's getting ready to be executed in October. Attracts. I don't see. If I see the board lit, then I'll go from
I
there.
would like to highlight what we're doing now. We're hiring college students in their last semester of college as a part-time employee. We've named it the STAR program, and I can't tell you what it stands. Student Talent Acquisition Recruitment, I think.
Very
There you go.
good.
And we have our first one in the office. During this last semester, they will be doing all the training that we normally do with you when you come on and start with us for 6 months. So they'll be learning all the things that they normally go through in that 6-month training. So when they graduate, they will be ready to carry a caseload. Not a full caseload. They'll still have to be supervised and all that. But this, I think, is a phenomenal step in the right direction to shorten the time frame that it takes for us to get people to full case carrying staff. So
Very
that's
good.
that working with the universities.
Very good. Item F, I think we talked about that pay incentives. I think that item was covered. So now we'll go to page 2. And members, if I'm going too fast, just you stop me. But if I see the board's lit, we'll go from there. G is attract staff, hiring, planning, and caseload forecast modeling. And some of that looks like it's been accomplished in September. And it looks like one of the tasks will be ongoing every month on that issue. The board is clear. Staff health and wellness, evening and weekend coverage. It looks like that's been accomplished, and you have some more going on that.
I would like to just point out that that is one of the things that we talked about as being a critical piece for our staff, is that the same people who are working Monday through Friday, come to work at 7, never know what time they're getting off sometimes, and also have night call and weekend call. And so we are piloting in 2 places. We're starting in Baton Rouge, and then we'll be quickly jumping to New Orleans with it. We interviewed 3 companies that provide supplemental staffing, social workers, that have told us that they can get them to us within about 3 weeks. And they will go through our training, and they will take the night coverage. Now, the first couple of months, it will be in partnership with our staff, but our goal is that ultimately they will be able to cover the work for our staff after hours. So we'll plan to do a 3 to 11 shift, 11 to 7 shift, and then weekends as well.
Very
And that
good.
will relieve our staff from having to take night call. And it will be for our intake investigations and also foster care staff if they have emergencies that happen that can be handled that way.
Terrific.
There's one of the things you've heard over and over from the people that are reaching out to you is the demands of the work and how they don't have work-life balance. If I had to pick one thing that I think will impact that the most, it is taking away night and weekend work from them so they will know when they get off. Now, those night shift people won't carry the caseload. Think of it like in a hospital. The night nurse is going to hand the case off to the doctor and the day nurse when they come in. So we're working with the judges because that means a change in protocol of who goes to court. Because in the past, you got the case during the night, you went to court. So we're working hand in hand with our judges on all of those protocols.
Very good. One, if it can be done, I'm sure it can be, but as let's just pick on that one item. On H, it says explore contract options and staff preferences, and it says October is the goal. What I think would help in the discussion, not to have the meetings too lengthy, if that's been accomplished, keep it in green, but put a little highlight on it that it's been finished. If it's not been finished, then it stays in green. I think that would help us to understand, if it's been completed, then you put the star in there so we can hit those goals. Senator Barrow?
Yes, thank you, Mr. Chairman. One of the issues that I heard early on when everything kind of started bubbling up with the department as it relates to staffing issues was how cases were distributed. So I know that I think Ms. Ricks is kind of doing something with the staff and working with the staff and hearing from the staff. So now that we are going to be starting this new model, how are we going to be ensuring that whoever gets the case the next day, how are those cases going to be distributed? Whoever doing the night work, is there going to be somebody who takes all of the cases and then distribute them out to all of the workers? How will that process work and make sure that it's done, I guess, fairly, equitably, and that not one person is doing too many of the cases?
Yeah, so that is all of the work that's going on right now. How do we hand off those cases? Right now, if you are on night call, you're not getting cases during the day. You're not getting.
No, I'm talking about when the new group comes in.
So we're trying to change it from the night call model and make sure that we have a way to hand off to people that is, as you said, is equitable. We're working out all of those details right now.
Okay.
We really don't have them all worked out.
Okay. Okay.
We're negotiating with the providers to make sure that we have some overlap, to make sure that we have time to transition the cases over, carry over the information. So as soon as we get all those protocols in place, I'll be happy to share all.
Who are the providers? You said there are 3 companies.
Yeah, the contract. The contracts aren't.
I'm not sure we can
finalized
say
yet,
those yet,
Gotcha.
Senator, because we're
Okay.
in contract negotiation.
Okay, gotcha.
But we'd be glad to provide that as soon
Thank
as we
you.
can. They are Louisiana companies.
Very, very good. So the next key items is remaining on staff and wellness through J. Anything more that y'all would like to comment? I see the board is clear right now on that. If not, we'll go to K, which would be enhanced staff capacity, incentive training, and professional development. Looks like that's been pretty much accomplished, and y'all do have something right in March to look a little bit deeper into a topic. Any issues that y'all like to bring out?
I would like to highlight and recognize at the table Evelyn Jenkins, who I mentioned earlier. The way Evelyn came back to our attention was she led this program that is highlighted here under K, Create Advanced Leadership Certification through Grambling University. Evelyn was the one that created that program. It's a leadership program for our staff of the supervisory level or above. We had a graduation for the program at the office, and Evelyn and Dr. Rice and the head of the Dean of Social Work all came for the graduation, and it was a lightning, aha, there's Evelyn, maybe she could come and help us. So if I could deviate or Senator Mills, I just want her to be able to say a few words whenever it's
No, please do.
appropriate.
And I know the secretary was really happy to have you back, and that she was beaming to know you were back in the department. So yeah, if you'd like to say something, please do. And as we work on these topics, feel free to jump in, please.
All right, good afternoon. As Secretary Walters said, she did ask me if I would be interested in coming back to help during this time. And in that, I've spent many years in the child welfare program. I wanted to succeed, so I did agree that I would come back and assist with the day-to-day operations. So I see my task as trying to help the workers to refocus and realign with the mission and the goals of the department and of the child welfare program, overseeing them to ensure that the best practices are being implemented. I have visited 3 of the offices. I've been hired about a month now. And so I visited office in Lincoln Parish, which is where I reside, as well as the Lafayette office and the East Baton Rouge Parish offices. And what I found is I found staff who were dedicated and committed and wanting to do the work of serving children and families. However, I also found that they were had unrealistic caseloads, and some of them were functioning outside of their duties, such as supervisors carrying cases, and so therefore not able to commit the time. But once I've come on board fully, I do also see that there are dedicated and committed staff working collaboratively at the leadership level to try to address the needs of staff. And so that is an inspiration for me to continue forward in trying to help the staff to start focusing on best practices, being good community partners, and letting others assist with the work. And so the projects that they're rolling out, I will be helping to implement those in the field and helping staff to take advantage and utilize those, such as the 211 United program, helping them to make those referrals and make those connections with families so that families can get the resources, and just trying to help them to really fulfill the mission of the agency.
Very good. Thank you and welcome, and thanks for joining the department. I guess in your training, because it's so critical, you can have your training manual of what you need to do, but you also have to develop a critical thinking on knowing when to move and when not to move and when to make an assessment. Does that training help critical thinking?
It helps with critical thinking as well as just general leadership principles.
Got you.
Yes.
Okay, well, thank you so much, and jump in at any time. Like I said, this is kind of a working meeting with both groups. So we just covered item L is support retained foster caregivers, and I see where you raised the average board rate from $15.20 to $19. That's been accomplished. And anything from either side on foster care?
Members, I would acknowledge and celebrate that you raised the foster care board rate. That came straight from a legislator that brought that up in Health and Welfare in the House. Representative Mike Johnson was the one that fought for that raise and got that raise on the board.
We'll all pat ourselves on the back a little bit on that one. M, retained foster caregivers, services, anything on that item?
We know that foster parents have the same struggles. We lost a lot of foster parents during COVID. A lot of them just simply were not able to continue, and so we are doing a push to gain foster parents as we push to gain staff as well, and to support them so that they are able to handle the kids that we get and do everything that they need.
Yeah, item O talks about hiring a statewide recruiter, which was done. Are y'all seeing some fruits to that that hire?
We are, and in fact, there was an event that the First Lady hosted, and the recruiter was there working with others, and it was faith-based leaders who are going out to help us now with recruitment efforts. We have one group that started in Baton Rouge 2 weeks ago where they're doing weekend certification now, and they were able to get 18 families in, and they are doing their last weekend certification this weekend, so we are very hopeful that we'll be able to get all of those through the process quickly and get more foster parents on board.
Very good. If you turn to the next page on all sides, item P and Q also talk about foster care, training, recruitment, especially it talks about the pilot program in East Baton Rouge. We do have Senator Mizell on that.
Thank you. Thank you, Mr. Chairman. I don't want to lose this opportunity because I think we've all, especially since the Landrys came and testified, we've all kind of been a catch-all mechanism. And I'm going to, if we're all having this conversation, the foster parents I talk to fear coming with complaints or questions of decisions or actions that they feel were not in the best interest of the child. So when I see, I think you called it the, I just lost it, a board or a family, is there some opportunity for them to do something anonymously or, and perception is reality at some point. And when you have a child they so care about and they feel that any complaint about some procedural frustration or worker frustration is going to take that child away, you're never going to find out what's really happening. So it's a missed opportunity to correct it on both ends. So what do you tell those people?
So there are two things that we put in place that we are hoping will have a big impact on that issue.
Okay.
Because it is very, I share your frustration about that. One is the Foster Parent Advisory Board. So
Yeah, I saw that.
we sought nominations from the foster parent group at large and our staff for someone who wanted to represent their region, a foster parent who wanted to represent their region. We made sure that as we were developing the board, we have foster parents who have been there some time to some who are brand new, just a wide diversity of foster parents. They in turn determined that they want to focus on three areas. One is around communication, one is around training and support opportunities, and one is around policy. And so each of them, they divided into three groups, and they're going to have outreach. Each will take one topical area. They're going to have outreach to their peers who are foster parents, bring back information, figure out how, for policy, for instance, what makes sense, what policies do they think need to be revisited, what what's the opportunity for them to weigh in on policy? How can that happen? So trying to look at each of those topical areas to say, how can we make improvement, be more transparent, have their voice heard more,
Right.
and resolve issues. The person who is co-leading it with me is a foster parent, and so it's very helpful to have that partnership there, someone who's walked those shoes too. So that has a lot of promise. We have regular meetings on it. It is just really getting started, so it's trying to get everything in place. But we have the people identified, and they've met several times already.
So that foster
One
person
piece.
you're working with, okay, go ahead.
The other piece, you'll see the support group and then the ambassadors. So
Yeah.
every tri-region has an ambassador. We have a contract for foster parent support with Rick Wheat and Methodist.
So the ambassador is an
Ambassador.
actively engaged foster parent.
They are advocates for foster parents in each of the tri-regions.
But are they foster parents?
I believe they all are. I'm not sure. Are they all foster parents, ambassadors?
Are they? No,
No,
they're
I'm
not.
not sure if they were.
Yeah.
They work with the organization, and
but-
they help with training, they help with support groups,
But
they
who,
connect them.
are they being paid?
They're being paid.
Who's paying them?
Through Methodist, the contractor that we had, hired
Okay.
ambassadors
Okay.
for each of the tri-regions.
Then again, when, you're not going to bite the hand that feeds you. Usually. Sometimes that happens.
Well, we're trying to create opportunities
But the
for
trust,
to
I
resolve
don't know if
issues.
a foster parent is going to confide in a person that is under contract.
Yeah, we
You know
took
what
it out
I'm
of the
saying? I'm just
department
trying to get it
thinking
where
that
there's
that
a
would be-
safe
Yeah.
opportunity for communication.
Well, I'd
Yeah.
love to work with you about some ideas that you have that
Um,
might have some distance.
Yeah.
That would make them feel.
Because
Yeah.
we did take it away from contracting with us and gave it to Methodist, so they
So
work
that,
for
so
Methodist.
okay.
So,
Okay.
yeah, we're paying
Maybe
Methodist,
that
but
would-
they work for Methodist, and so
Maybe that,
hopefully that makes it.
it's forward motion, so,
We have ideas. I'm wide open. I have the utmost respect for foster parents. And
oh,
I'm
yeah,
trying to
I do too.
everything we
And
can
when
to
you
support
hear
them.
their, frustrations,
Absolutely.
and the most upsetting part is that they feel, they're fearful. So, anyway, thank you, Mr. Chairman.
And members, this is what, as the topic comes about, that's why I'm kind of going through those topics. If there's a topic you really want to bring out, just bring it out. Same way with the department, if there's something that we need to bring out. Senator McMath, on that same kind of vein of thought.
Yes, thank you, Mr. Chairman. So the Foster Care Advisory Board, how often, you said you've met a couple times already, how often do you guys meet?
It's every other month.
Every other month? And how many members are
They're
on?
working in
In between?
meantime. Yes.
So there's
There are
action
9.
items that need to take place,
Yes.
take back. And
Yes.
9 you said?
9, one for every region.
One for every region, okay. And then the timeline on, the goal is to have, what are you going to do with this feedback that you're getting?
Try to incorporate their recommendations. So, for instance, they identified the areas that they felt like needed most attention. So, what do they determine right now? They are surveying their peers. What policies are the biggest pain points for foster parents? And then they are going to meet independently and then come back with recommendations to us, and we have a programmatic person from every area of the department that is also assigned to assist them with getting the information they need if they are trying to figure out why is this like it is there some reason for it. We have someone assigned from each program area to assist them and then bring the recommendations back to the larger board and try to implement.
Okay, I love this, by the way, so thank you for, this is a great way to address, I think, a lot of the concerns that we hear. But the idea, though, is to ultimately have some sort of final list of recommendations, a report, is that?
And it's ongoing, so it is a constant opportunity for them to continue to review and revise and provide input.
Okay. Well, whether we do this, in a public setting or if it's just a handful of us that are meeting, I would love to have the opportunity to be, included in at some point, maybe in the beginning of 2023, and just see how the program is going, what their recommendations are, and because this is as Senator Mizell said, this was kind of one of the things that was sort of been a catalyst for, I guess, where we are today. So thank you
I'm sure
again.
they would welcome having you all on there. We've been meeting by Zoom because it's people from all over the state, and it's
Sure.
just easier for them to do that. And so we'd love to have you
Okay.
participate.
Thank you.
Thank you, Senator. So we're now going into bullet point 2, multidisciplinary response with key partners, and you did over the last 2 meetings cover a lot of that, and your partnerships and looking at different models and working on a pilot. I guess because it's such a small category from A through E, is there any things y'all would want to bring out or the committee members would like to talk about? I know you've achieved some goal, but it looks like a lot of at the November meeting we can really talk more, because it seems like just so everybody know, our next meeting is November 30th, but it seems like a lot of your hard work is between now and November 30th. Senator Mizell.
Real quick.
Take your time.
Thank you, Mr.
Take your
Chairman.
time.
So when I'm seeing CASAs, that is such a pool of potential workers. Have you
We did have a
have you
meeting.
courted them?
We have.
Yeah, yeah.
Yes.
Okay. And are you getting any?
We are. There are some things that they're trying to balance. So, for instance, we talked to them about being a resource to help with visits or to help with transportation.
Right.
It was met with mixed reviews. Some think that is their role. Others feel like they would really rather stay in their lane of what they're doing. So the dialogue is continuing to try to determine for those who want to, how do we let them be more involved? One area we've specifically asked for their help in is the educational advocacy. So we'd like for them to take maybe even a lead role with our staff alongside in advocating for the educational needs of the foster kids that they represent. And so they're receptive to that. I believe they're trying to work through some things about who technically can be that representative at an IEP and that sort of thing. But they're working on that in particular.
Are they allowed to attend an IEP meeting?
That's part of
Oh,
what
that's
they're
what
working
you don't.
on.
That's what you're. Okay.
But that is one area that we would really like for them to help us with.
So, in that direction, I don't see the billboards and the active, wide open recruitment toward. And this is at you all, but do you know? Is there a problem with the funding for them, or?
I'm not aware of a problem. I
just don't see-
We have done even joint community meetings where we've tried to do recruitment together and trainings together.
Right.
So I know they certainly are still recruiting, but I've not seen.
I just
billboards
haven't
or-
seen it like I used to.
Yeah.
Thank you, Mr. Chair.
And committee members, while we taken just a real slight detour, Senator Luno told me that there is something that's planned on the 30th of November that might keep some of the committee members out. So why don't you look at your calendars, and if we do see something, maybe we might want to move it to the 1st that Thursday. But we can talk about that some more. Yeah, I think I'm seeing it might just be me over here, me and Ms. Peck. That might be the only ones. So we might move it. We'll talk about it a little bit. We'll poll everybody. So on that note, I'm sorry, did I cut you short?
No, I'm good.
You
Thank
done? Okay. So y'all, the next item would be prioritize high-risk infants and toddlers, and I know we've talked about that a little bit, and I do want to bring out. I guess the thing I'd like to maybe talk about is improve oversight of high risk in home cares, is East Baton Rouge pilot. Maybe we could talk a little bit about that, because I know that was very important for Senator Barrow.
Our staff are working with the judges in East Baton Rouge to talk to them about a procedure to have greater oversight over these high-risk cases where we believe children can remain in the home as long as there is a commitment to the case plan. And so what is happening is that there are a lot of times when the danger is not apparent enough for us to ask the judge for removal, but we're trying to work in home. The parent may or may not be fully cooperating, and so we'd like to work with the judge to have court oversight on those cases so that if they are not willing to participate and the children are in danger, we move to foster care. Otherwise, we'd really like to keep them in the home.
Senator Barrow, all
You
yours.
concerned about that, Senator Barrow?
So let me just kind of go through, and I really don't want to use that scenario, because we want to make sure that never happens again, right? And as I look at that particular case with the baby, right, with the fentanyl, and y'all have to work with the judges because they have to make the determination, right?
Yes.
And I don't know exactly what happened in that situation, because to me that, you know, we're looking at the department, but to me there's some other folks here that I need to say are almost as equally responsible. Yeah, you guys are having conversation with the judges now?
We are.
Okay.
The
And-
leadership in the Baton Rouge office, including our legal team, is meeting with the judges and other attorneys there that represent parents and others to vet this and try to think about how do we not unreasonably expect people to be part of a court system, because generally family services is a voluntary program. But there are times when if the parents are not willing to participate in services that are necessary to keep kids safe, then we expect it to be court ordered. And under that monitoring, that sometimes that's what it takes to get people to commit, realize how serious it is, and participate. Other times it still doesn't, and then we have the judge who has the authority at that point to take an additional step and order the child into our custody.
So are we looking at ways of how this can be fast-tracked as well? The process can be fast-tracked?
To do more
Yes.
court oversight. So it is available now. We're talking to them about their capacity to take on more and to be able to
And I'm concerned.
Bring
I
more
guess
into-
my concern is, as we are seeing more cases, you guys are being, there are a lot of things that we never hear about that you are having to deal with every day. And I believe, I would hope, I want to be optimistic and think that it's going to get better, but my concern is that it's not. And so what are we doing when we have to really move very quickly with some of these cases, because 24 hours is going to be too long?
We do have the authority to call at any time that we feel like children are
Okay.
unsafe. We call the judge and immediately can request a court order. And our numbers in Baton Rouge have gone up significantly in the number of kids who are actually having to come into foster care. Last night, we had 9 children that we were trying to place in the Baton Rouge office. So the numbers continue to go up. Of kids coming into foster care. We used to be able to serve more children in their home. We don't have the capacity right now for staff to be in there as much as they would need to be certain that children are still safe there. And so, unfortunately, that ends up generally showing an uptick in foster care. So we are working with Family Services of Greater Baton Rouge to put into place a contract where they would assist us. They have a cadre of therapists and other resources available. So as they're working with the families, those resources will be available to families. The clinical resources, families won't be having to try to find mental health services. It will be there for them.
So, Ms. Evelyn? Okay. So, Ms. Evelyn, as you are coming on board and you know this as being an issue, what's your position? Is there something that you can add or something that comes to mind that you would like to see or that you would like to implement, integrate?
I think the projects that they have right now, especially the one with Family Services of Greater Baton Rouge, and then there's another intensive home-based program, those are the programs that will address those types of cases that she's talking about. But sometimes if the parents is not cooperative, then you may need to get the judge order to, kind of like Brenda said, to entice them to cooperate with the agency and with the providers that are trying to provide the services. And so I think that we are on the right track with the programs that are being put in place. And we just need to see if the judges will be able to assist us with more cases in terms of issuing that order for cooperation from the parents.
Well, certainly, I know that you guys are putting a lot of safeguards in place, and you're doing everything that you can. And at the end of the day, I know all of us are working towards the same goal to ensure that that never happens again. But I'm just still just a little, I guess, apprehensive. I'm not sure what's happening with some of those parents, and we know we probably have a lot of those parents, right, who are not going to be cooperative. And in those instances, how are we kind of making sure that we're fast tracking, moving it quickly, so that the child is not put.
Yeah, in those cases, generally your intensive home base, you have someone that's there on a very regular basis for long periods of time. And so their assessment should be able to indicate if this is not working and we need to call the judge and request an instanter order for the children to come into foster care. So it should be an ongoing assessment that's occurring that will help us to realize when it's moving to the situation that the parents still are not cooperating and something further needs to occur.
I guess lastly, I will say, because I know this is part of the department's motto in terms of keeping the child with the parent or with the family. I want us to kind of maybe broaden that a little bit, because maybe family may not be the necessary family that they live with, but it could be extended family, and that we really look at, rather than our first alternative is to try to keep them with the family, maybe we need to take them out temporarily and put them with somebody else with the family if they're willing to take them, because I think sometimes that has led to some bad outcomes. I just personally believe that. I know that at the end of the day, we don't want to break up families, but sometimes I think that we need to make that an option first rather than second, if that makes sense.
It does, and I think that with the safety plan, generally we involve other family members at that time. I've been away a little while, and I have not caught up with everything that's going on now, but I know in the past is that we involved families to help oversee, and the family members can tell us what's going on also, and whether or not problems are continuing, and if it's escalating to the level that we think that we need to remove the children.
Thank you.
Thank you for your question and answers. Senator Mizell?
We're tag teaming. Thank you, Mr. Chairman. Listen to the numbers, and I know how strong my colleague cares about everybody that we're talking about today. But what I'm wondering is, on the numbers, like with East Baton Rouge, I know it's a mixed bag through the state, but the increases you're talking about, are those mostly drug-related, substance abuse?
Yeah.
So it's mostly where the parent is not able to care for the child because of an overriding situation with the drug addiction. So is part of what we're doing, when we set up a reunification plan for that child that's being neglected because of the home situation with the drugs, I'm just wondering if we're doing it in a way that didn't address the drug situation we've got. We're doing it the way we did it with the reunification. That's not possible for someone addicted to recover from in time to get their child back. Am I making sense to you?
So it would always include drug treatment if
Right.
if
But
drugs
that, in
are-
order to do that, the children have to stay with somebody, foster care. I don't know what the
And it
percentage.
depends, because there is such a wide range of people who use drugs. So there are people who use marijuana and have lots of children in their home that they are able to
Oh, it's all
safely
different.
maintain.
Yeah,
It
yeah.
is. It's just such a range. If we took every child of a parent who uses drugs, the state would be overflowed.
No,
But-
and I'm not that's not my point. My point is, what I get, and I don't know if my colleagues get this, is either the case plan is just checking the box and it's really not making a change in the parenting ability, or it's way too hard, the parent can't possibly accomplish it. It's one of
It is.
those. It's one of those. And when we have an overriding number of parents that the drug addiction is the reason we're having to address the need of the child, maybe we need to look at a different model. And we could talk about this, but Kentucky just did something that is like with what you're saying today. Kentucky has residential facilities now, and I think there's a pilot in New Orleans right now where the children go with the mother.
We do have
The
that.
mother's not being deprived of her children, and her children are being counseled and helped at the same time that the mother is being brought out of addiction.
We
So,
do have that.
is that only in New Orleans, though? Where is it? LA Safe, because I know VOA said that they're doing it in New Orleans as well. But we're going to have to, we got to get outside the
A
box
couple of
because
programs like that. We are part of, LDH was just awarded a grant and they were accepted into this policy academy, and we are part of it. And it is to look at how
long is it going to be? How long can you look at it? How long is the grant going to give you?
I don't know. We
You
just
don't
got
know.
notified
Okay.
that they received it and that we were part of the application. And so it's a policy academy where you come together with other states and look at how do we address this issue? What are the best practices? How do we get out of the box? How do we make sure people have the right resources and that in the meantime, children are safe?
Well, yeah, because the mother's having to leave the children to go to a long-term treatment center. It's not working on either side. So, okay, anyway, we'll talk about that. Thank you, Mr. Chairman.
Very, very good. So, members, we do have, if you turn that page from B through L, many of these topics have been discussed over the last two meetings. I guess I would throw out to the committee members any questions you have on it, or if there's any specific things that the department would like to either highlight on that. I guess the only thing I'd ask is, looks like you hired some nurses for a pilot program in East Baton Rouge. Is that going well for you?
Very well.
Very well. Very good. Because I know y'all had mentioned that earlier.
Yes, very well, and we really recognize the necessity of having that resource available to us throughout the department.
So, I think Senator Barrow wanted to
Really
question.
quickly, are you guys integrating the nurse partnership program into
Nurse-family
your work?
partnership?
Yeah, nurse family
So,
partnership.
nurse-family partnership, the criteria is a first-time parent
Yes.
and within the first trimester. So it generally does not fit in, although sometimes it does, particularly if there is a, for instance, in our extended foster care program, if one of those young people becomes pregnant for the first time, we do have priority in those programs.
Okay.
They are put in, and we make sure that they're aware of the resource.
And I keep forgetting about that in terms of the first child, because it's such a wonderful program. Because research has shown that once you're able to really make sure that those children make that bond and connecting at birth in the hospital, the chances of them being great parents are really, really high. So,
So Child First is a partner with Nurse Family Partnership.
Okay.
And it serves them until the child is 5, I believe, is that model.
So you guys are working with them?
Child First is part of, yes, it's the same parent company, and so many of the strategies that are used in the Nurse Family Partnership Program are also incorporated into Child First.
Okay, great. Thank you.
Thank you, Madam Vice Chair. Anything more, y'all, on items B through I? Anything more on that? Everybody's okay with that? Number 4 of the 7 bullet points: coordinate with managed care organizations. Kind of help us to understand, because this committee has heard a lot about the 5 MCOs and the capitated rates and with their delivery. What you're proposing here to select managed care organizations to serve foster children, and the work you're doing, are any of these services contractually already obligated from those managed care organizations? Because it seems odd that some of the MCOs are saying we can do this, others are not saying that, because it seems like with them being paid per member per month, I guess I would just pick on the foster child portion, because it seems like each child that's in foster care, I would assume, should already be covered under the managed care program, so y'all shouldn't have to be doing more things. So should we be calling in the managed care organizations at the next meeting to say, okay, here's what we're expecting of your contractual obligations. What is DCFS having to do differently on this?
So that is what we are trying to figure out right now, because the contract, there's a current contract now that we operate under, and then there is a new contract that is effective in January. And we are working with LDH to look at the components of the contract and to make sure that at the ground level that the practice actually works for us. For instance, being able to have access to 24/7 medical consultation, telehealth. Some providers will offer that, others do not. We have got to have that where that is available to staff and foster parents. If we bring a foster parent a child who has diabetes, let's say, and they've never cared for a child with diabetes, they ought to have access
Correct.
to medical consultation immediately to understand medication and that sort of thing. So there are a lot of pieces to the managed care program that we need to shore up and make sure that are actually available to the children.
You know, not to cut you short, but we pay these managed care organizations to move the needle, especially like on that disease state, and they're getting paid so much per member per month. And when we've looked at some of the medical loss ratios, some of these patients are not even being seen on primary care. So this is something that we may expand on. I saw Senator Luno vigorously hit his button, so I think he's got something to say.
I would really like to have that information for our next meeting,
Okay.
so we can address that.
Okay. Be thrilled to
We pay
partner with you on that.
lots of money for these services, and they need to provide the services that they've contracted to do. So let's try to address that next meeting.
Yeah, I kind of thought we were at an all-you-can-eat buffet. I don't need to pay for some secondary meals. So, you know, I mean, it's true. It's like I went to an all-you-can-eat buffet and they tell me what it's going to cost $10 for the baked potato. I don't think that makes sense.
Well, and you know, I will just say that they operate under Medicaid rules, and so it's medical necessity, and oftentimes medical necessity does not correlate to functioning well, and so payment may stop for something. They no longer authorize payment for something because it's not technically medically determined to be medically necessary, yet
Well, we're going to have a conversation. And I
need to work those things
And I will
out.
tell you, let's, between your department, LDH, our staff, I think we may need to call in some more folks on what's their contractual obligation to meet. So why don't we put that on our major to-do list, and we'll all work on that one together.
Be great.
So on that note, unless anybody wants to talk more about managed care, I think this one is going to be a to be continued, huh, committee members? Okay. All right. Ms. Peck, anything you think we missed on that one? Seriously. Because she has a lot of experience from this arena.
I just think it might be beneficial to all of us in the room right now to understand better what the indications are, because select managed care organizations to serve foster children, and you have a check mark by it that you've selected 3. Have you entered into contracts with them already, or what have you committed to? I think that's important for us to know as we're trying to understand, if we're talking about the Medicaid population, what are they're already supposed to be providing services, so we just want to make sure there's not duplicate contracts floating around right now.
No, so
Good point.
the contracts are with LDH, and then LDH contracts, I believe I'm speaking right, with the managed care organization. The managed care organization is responsible for the provider community and contracting with providers. We are over here just the recipient of the services, just like a parent whose child is receiving Medicaid.
So
we're a
what is
step removed.
your indicator here is that you all completed this task in September. What specifically is the task that DCFS completed with regard to these 3 MCOs that you referenced earlier?
So we had interview with each of them to understand what they were willing to do above and beyond to try to serve children in foster care. So for instance, one of them is willing to have ongoing rounds with us where they will provide a physician to walk through the case and talk about a child who is in a psychiatric residential treatment facility, perhaps, and actually help us move that child to the next level of care. So these very difficult cases, they are coming to the table weekly to have rounds with us and discuss these cases. Everybody doesn't do that. And so it's not necessary, I guess, as part of their contract. So others who have said, we will go above and beyond to do some things. We also would like to have someone help us develop a sort of a sub-provider community who are willing to develop some expertise in child abuse and neglect and really understand what we're needing when we're talking about an evaluation of a child in foster care. We don't need to be bringing children to the hospital for routine evaluations. It costs a lot of money. It's inefficient, and so we need to have local providers who are willing to see our children in either urgent care setting or in their offices. We don't have that provider network right now established.
Ms. Peck, any other thoughts?
I have a lot of thoughts,
Yeah, I
Mr.
do too.
Chairman.
I have a lot of thoughts, and one of my thoughts is as the vice chair and I were talking, that should be managed care. I mean, that is part of managed care, and that's where. Anyway, we probably all talking to each other on the same page, but let's put this as a major to-do, and one of the two departments and staff will talk it through, but we're going to probably need to splinter this into a deep conversation at the next meeting.
Okay. And they may say there are things that are part of the contract and they will be willing to do that just haven't been brought forth yet. So that's what we're trying to explore with them. We're saying here are things that we're not getting, and they're a pain point for us right now. How can we get that? Is it part of the current contract? If it's not, then do we have to have a subcontract for that? So, for instance, the thing I talked about earlier with mobile crisis. LDH has put into place mobile crisis for adults only. It's not for adolescents. Yet mobile crisis is one of the things that's been shown to be extremely effective in being able to maintain a placement. So we would like to have conversations with them about the opportunities to implement mobile crisis for adolescents.
We just don't want you to have to buy something we bought.
Yeah,
That's the bottom line. That's the bottom line. Have y'all entered the contract already?
No, so what we will be doing actually when we say a contract, we have children who are already in our system that need to be assigned to one of the managed care organizations. And so it's that process of assigning children to those managed care organizations and trying to figure that out, and then having an agreement with them about the way the procedures will work. Will they have someone available to us when we don't have, when we're having a problem with a child who needs to get into a facility that is saying that they won't take them? Those kinds of things. So it's not the official contract of what Medicaid covers, it is the practices and the on the ground making it work.
Well, if it's Medicaid coverage, you shouldn't have to be working on the networking. So we'll talk more on that issue.
That would be great.
And I appreciate that. So that one is going to be probably a big item for our next discussion. Item 5, y'all, is enhanced training and coaching of staff. Y'all talked a little bit about that. It seems like you have some pretty good goals for October, November, and December. Anything the department y'all would like to add to that? Because I know y'all talked about training a lot.
Yes.
Members of the committee, any questions you have on that issue? Seeing no questions, then we are making progress. We'll go to item number 6 on the very last page. And I want to thank everybody for your patience, but I think this was important. We drilled down on that. So improve safety decision-making, intense oversight of complex cases. I think that's probably really critical because we've always talked about critical thinking, and you can train somebody as hard as you can, but they do have to have critical thinking to know when it's the time to make those decisions. It looks like you're going to be doing some of that in October. Anything y'all want to expand on that? I know we've talked about it.
Just that there is a model that has been proven to work in several other states that is, we call it a central consult. So it's centralizing the availability of a supervisor to walk an investigator through a case and close the case expeditiously when it's determined that all the children are safe and the case is not valid. And so that frees up the time of the supervisor on the ground in the office to really focus on those more complex cases where children are not safe and they really need to do some safety planning.
So in your pilot project that I see on A, subtopic, key, centralized consult and decision-making in the different parishes, talk about it. Have you had success?
It's going very well, and we are expanding statewide.
Expanding state. Okay, very good. Committee members, any questions on that topic? Seeing no questions. Then number 7, conduct critical incident reviews. Anything we'd like to add to that?
I believe you have information about the critical incident reviews. KC Family Programs is sponsoring our membership in this consortium. We will start in January. It is a group of states that come together to look at critical incidents, most notably fatalities, to look at what are the common factors. What they found is that it's easy to just blame one person, either the caseworker or the parent factors. Where do you just put that blame? But oftentimes there are systemic factors that they really think if we could look at, we would see a whole different picture, and so our interventions would be different. It's a practice that is used in medicine. It's used in the airline industry. Those are incidents where it's hard for people sometimes to come forward and acknowledge mistakes along the path. And so it's creating this safety net to be able to talk about those potential mistakes or those processes that are in place that have the potential for a bad outcome. And so that is creating that culture where we can look more critically at fatalities and other incidents that happen and really understand how we might be able to make changes to impact that.
Senator McMath, all yours.
Thank you, Mr. Chairman. I'm actually familiar with this in terms of the airline industry. I think when, I don't know if it was United or American or Delta, but when they implemented this within their own company, this sort of self-reporting that would be free of any sort of backlash, it dramatically, well, one, all the other airlines quickly adopted it, and it dramatically reduced the rates of incidences to the point where I think we've only had one, knock on wood, one fatality since the FAA has imposed this across the board. It's a wonderful way to conduct your business, and that's very encouraging to hear that you guys have adopted something similar. That's all. Thank you.
Thank you very much. So members, we went through the tasks, the different tasks and the timelines. Unless you disagree, I think at the next meeting, and we're going to have some concluding thoughts. I'd like everybody's thoughts, but I guess from the action steps, what I'm thinking is we'll really concentrate at the next meeting on what was said in October was going to be looked at, in November was going to be looked at. We'll drill down on those topics more because there's some long-range things that there's no use getting into what you want to do in March of next year, but we'll see what we accomplished in that period of time. And members, if any of you have any other thoughts, let's communicate that to the department to put on the task list, to put on the to-do list, and we can go from there. And we do have a question by Senator Pope.
Now, I think I heard a while ago, and I threw out something a while ago that whether I explored or not is irrelevant, but I think you had mentioned the number of employees that you have when that 3,200. Is that correct? That's the number? Yes. Thank you.
Thank you very much. Any concluding thoughts from any of the members? So, Senator Barrow?
Thank you, Mr. Chairman. And I appreciate, again, all the work that you guys are putting into this. It certainly is being reflected here today as we look through and hear what you guys are working on, the plans going forth, and et cetera. One thing that I must say, and I think it's real important, and I know that we all recognize this, but the people working in this industry are working in this industry because this is something they feel either called to, they have a strong willingness of wanting to give back and help people, because clearly they don't make enough money in this arena. When you look at the rate of pay and the range of pay, it is not a lot of money. And so they are committed to the job because they want to make a difference. They want to help somebody, and they want to make sure that somebody has maybe a better path or a better way than they may have had. Sometimes these experiences comes out of their own pain, oftentimes or sometimes. So as we are looking at all of the different measures, because y'all have a lot of things that you're looking at, which is really awesome, which means that you're really evaluating to see what works. I guess my only concern would be, something that I think Senator Mizell, Pro Tem stated in terms of, trying to see what sticks. Kind of just being real careful about that, because you have a lot of things that you're looking at, and I think a lot of these things are great. A lot of great practices, a lot of best practices that have been used in other states. But we won't know until we try. But if it's not working, knowing to pivot real quickly to what does. And so those are just my final comments, and I just want to applaud the workers who are doing the hard work, because it is not easy. And I don't know if I could do it, honestly, because I don't know if I could every day get up after going and seeing a really bad case and having to get up the next day and having to do that all over again, and seeing some of those faces that you have to walk away from, and knowing that you're limited in terms of what you're able to do in that immediate time space. That's hard. So I applaud them, and I want to say thank you. Thank you, Mr. Chairman.
Very good. I want to thank the committee members for your hard work. I know you have fielded a lot of calls from the public. I know you've had a lot of pressure on you from the press, from your constituents. So I want to thank each and every one of your committee members, and to stay into a working meeting for 3.5 hours. I can't tell you how much I appreciate you. On that same note, I want to thank Ms. Peck, and I want to thank Ms. Cannon, because just questions were rolling in as early as 30 minutes before the meeting, and Ms. Peck was on top of answers and give us information, and we so value you. And Ms. Cannon, thank you all so much. Thank you so much. And I'm not sure, I guess I'll really want to conclude it with what the Vice Chair just said. If any of the folks from DCFS are watching this hearing, we so appreciate you. We so appreciate the work you do. And we want you to know that we're working to make it better. So if we found 100 things that are wrong that we need to work on or correct, there's 10,000 things you're doing correctly. So don't let this spreadsheet think that you're broken as an employee. Just know that we want it to be better, and we can always be better. So on that note, unless y'all had any concluding thoughts, we'll look at the calendar, because Senator Luno did say that there's a function or an event that most of the members may be at. So maybe I'm looking for maybe December 1st. It'd be a Thursday instead of, but we'll poll you guys. We'll poll everybody and see if you're available. We'll get with the department. We'll talk to you about it. But Ms. Peck, please put on our agenda that we want to deeply dive into the managed care piece. You got it. So on that note, I know we're not going to get a motion of opposition, so I think Senator Carter would like to make a motion to adjourn. If there's opposition, it's not noted. Thank you all.